Good afternoon. You are watching the Every Choice Counts podcast, and I'm your host, Dara Berger. And for those of you who don't know me, I'm the author of the book, How to Prevent Autism, documentary filmmaker and certified health coach, as well as the mother of 2 children, one of whom has autism. And I am extremely excited about today's show. I will be speaking to the author of the book, Gentle Birth Choices, and we're going to talk all about why how you give birth is so important and what happens shortly after birth changes a child's life and really could have a lasting impact. Now I would like to introduce today's guest. Barbara Harper is an internationally recognized expert on waterbirth and gentle birth, a published author who founded Waterbirth International in 1988 with one goal in mind: to ensure that waterbirth is an available option for all women. During the past 4 decades, Barbara has worked as an obstetric and pediatric nurse, midwife, midwifery instructor, childbirth educator, doula, and doula teacher, and has used her vast experience to develop unique seminars which she teaches within hospitals, nursing schools, midwifery, and medical schools and community groups worldwide. She was recognized in 2002 by Lamaze International for her contributions in promoting normal birth as an international level. Her best-selling book and DVD, Gentle Birth Choices, has been translated into 9 languages, including a 2016 Mandarin Chinese edition. She is working on 2 new books this year, Gentle Birth Wisdom and Embracing the Miracle, The Science, Safety, and Spirit of Birth, known for her award-winning website and online waterbirth certification classes. Barbara has dedicated her life to changing the way we welcome babies into the world. She is the mother of 3 adult children, 2 of whom were born at home in water, and grandmother of a college student and a 1-year-old. She lives in Boca Raton, Florida, where she is active in the community as a volunteer and a midwifery and doula mentor. Her website is www.waterbirth.org. So I am very excited to have you on the show. Thank you so much for joining us, Barbara.
Thank you, Dara, for inviting me. It's exciting. And it's a difficult time for all of us, so it's nice to have a good distraction.
Absolutely. I couldn't agree more. So I read your book 10 years ago, and I have to tell you, it was one of the most important things I did during my pregnancy. A lot of my audience has children with autism. My first child had autism. So one of the things we are very concerned with the second time around is doing everything much safer. Anything that could possibly be an environmental trigger. So I just wanted you to know that some of the audience are people like that you'll be speaking to. And it is the sole reason why I cleaned out for 3 years. And then I read your book because I desperately wanted to have a healthier baby this time around. So it was wonderful to reread your book again. And the first thing I want to ask you is, do you think that most women know that they have choices when giving birth?
Dara, I don't think that most women are aware that they actually can express their voice and find choices in their area. There's usually popular obstetricians. I get calls every single day still for women looking for options. Well, I'd like to have a water birth, and I don't know where to go. And so the first question I ask them are you seeing a midwife? And they'll go, what's that? I just had this conversation yesterday with a woman from Texas. And Texas is the 2nd most prolific home birth state in the nation. Just under 5% of the population of Texas birth out of hospitals. And most women, like, let's say you're a resident of Dallas or Fort Worth or Houston, they don't know that. So I'm doing consults with women all the time.
And so one of the things that I found so amazing about your book is there's a lot of books that just talk about natural childbirth. But yours was really special because you covered the whole gamut. And for me, my husband didn't want to do a home birth. He was way too nervous. If we were having a baby today, no problem. We'd have a bathtub set up in the living room and we'd do it on our own. But you tell people how to give birth in a hospital and how to watch out for and how to deal with all the things that come up, all the medical interventions that you might not want to have. And you saved me 10 times over, and a little bit later I'll explain to you. But let's talk about that. Let's talk about the fact that you can go to a hospital and not follow every one of their protocols.
Well, what I advocate, even since publishing, and actually the 2005 edition is now 15 years old. So I'm authoring a new book called Gentle Birth Wisdom, and it's taking all the good things out of that, plus my 40 years experience in hospitals and birth centers and home birth. And the premise of Gentle Birth Choices was to define what gentle means and define what collaborative care means. And there's a wonderful physician in Atlanta, an OBGYN friend of mine, Brad Boots Taylor, has just authored a fantastic book. As a matter of fact, I'm reviewing it so I can write a recommendation for the back of it. And it's about shared decision making. And he totally supports women who come to his practice that if you want a VBAC, if you want to birth vaginal twins, or if you want to have a vaginal breech birth, he will do all that as long as you educate yourself and you can make the decisions with him. And this is the most important thing that couples today need to understand. It's not about the hospital's going to let you or the doctor's going to allow you to do this or do that. It's not about writing your dreams and wishes. It's about having a plan of care and then collaborating with your provider, whether that's an OBGYN or a midwife in the hospital. And that's how you get the things that you most desire. You can have your list of dreams and wishes, but put it down and then discuss that and create a collaborative care plan with that provider.
Yeah, and that's something that's very important. And of course, because of the advice in your book, I did write down a plan, bring it to my doctor, discuss it, and we're going to go all through that. But first, I want to start with, why should we give birth gently?
Well, birth isn't about getting a baby out. It's about creating a new human being. And it's so important for both the mother to be respected in her innate abilities and to understand that the baby is the driver of the experience. The baby has grown a brain and wired a brain for surviving in the uterus, and everything has gone well. And now the baby has a program in its brain. It's a neurobiological behavioral program that says it's time to leave. and when we respect that the mother has hormonal directions and physiologic directions, and the baby has also neurobehavioral orders. I call it the first imperative: you must leave. And the second half of that imperative is you must attach to a breast. It's all one part of the same process. And when we intervene with, when I first started in OB 47 years ago, I didn't know whether to admit that or not. When it was my first classes in nursing school at the hospital, we called it affectionately knock 'em out, drag 'em out. Give the mother enough anesthesia that she won't remember a thing, pull the baby out with high forceps, cut an episiotomy to make it easier, and send the baby to the nursery, and then bring them back together 6 to 12 hours later, after the mother's had a good rest. And that, my darling, is a prescription for a society that's broken.
No, I totally agree with you. I mean, the difference between my son and my daughter, my son had every bell and whistle, and my daughter, everything natural. And there's such a difference in the outcome. There's a difference right in the days and weeks right after the birth with the child. It's incredible. Yeah. And so let's talk about technological advances, because there are so many that you have seen in all those years. Like, it's amazing what you've seen from early on to now go on. I mean, it must shock you. So what advances do you look at and you say, okay, that's helpful? And which ones do you look at and say, you know what, I would really try to stay clear. Those could be very hurtful.
Oh, that's a big list, Dara.
Yeah. Well, let's go through some of them, though.
Yeah. Well, when I first started, we did not have monitors. So this was in the early 70s, and we had fetoscopes, and let me show you what we also had. Hang on one second. Oh, I got it down just for you. Do you know what this is?
Wow.
I can listen to the baby's heartbeat. And this one's handcrafted from the Czech Republic. It was given to me as a gift when I taught there. And it's called a pinard. And we had these to listen to the baby's heart rate. Now, the monitor is a great thing. It can give you every single heartbeat of the baby throughout the labor process. However, there's a couple of things that's wrong with that. We don't have to listen to the baby's heartbeat in a normal physiologic labor. As a matter of fact, the doctor who invented it, Dr. Hahn, H-O-N, he said, I didn't mean it for that. I meant it for those women that had pathology, those women that were at risk, those women that had preeclampsia or cerebral palsy, the heart condition. If you were sick going into labor, then we were more likely to be able to rescue your baby if it got into trouble. And what has happened is just the opposite. We started rescuing babies by cesarean birth for the first little blip on the screen. And what happens is you get in there and liberate the baby by surgery, and it's perfectly fine. And you go, well, we didn't do any harm, right? And so there's a consequence of having a woman locked onto a bed, not able to move, and having fetal surveillance 24/7 throughout the whole entire labor. And the consequence is that labor must be active. For the baby to move through the pelvis, the mother needs to move. If you want the baby to move the mother. And so you have to release her, you have to liberate her. And that's what the water does. But you don't need a tub of water to be able to liberate a woman. And so for every good thing that has been invented, there is a positive side and a dark side to it as well. And the monitor is just one example.
And I'd love to tell you how one of the ways you saved my daughter in the pregnancy is that you talked about in your book with the monitor that anytime they see a heart rate go down, they just freak out and come in and say, you need a cesarean. They did that to me. They came in and said, you're only 9 centimeters dilated or 8 centimeters, but the heart rate's down. We got to get her out. And you know what I did? I thought about your book and I said, let me just stand up and change positions. Give me a minute. And guess what happened? I stood up, and within 30 seconds, they're like, oh, it's fine. She's fine. Yeah. And you saved me from a cesarean, your book.
Exactly. With that, I give cards, little business cards to couples that ask 4 questions. And the first question is, what will happen if we wait for 1 hour?
Right.
Okay. Second question, are there any downsides to us ignoring this? What if we just carry on? Another question is, will you give us time to discuss this? Leave the room, let us be for a little while. And don't put a parameter on it, because I tell women, you can get through 3 contractions, just 3 more. Just three more. And by doing that, just 3 more, you come to the end. The birth isn't over until the baby's on your chest. I call this space the sanctuary, because it's a very safe place, and the baby has a program for that place. So I ask couples, every intervention that they want to do, you should have an informed consent, an explanation, like, okay, let's just take a vaginal exam. Somebody pokes their fingers inside of you to feel the condition of your cervix, whether it has opened or closed, and what stage it's at. I'm sure you experienced that during your 2 births, right? Okay. And yes, and it's very normal. However, nothing about your labor is going to change just by having that information. And I ask providers when I'm teaching in a medical school, why are you doing it? What information are you going to use that will improve your care for the mother? Mm-hmm. And so instead of having this, it's classically, it was 1 centimeter every hour. And it was on this curve. And if you didn't match the curve, then they had to give you drugs to speed up the labor, and or do a cesarean because you weren't dilating quickly enough. And the thought that this is going to harm the baby is communicated to certainly the birthing person, but also the support person as well. And then the support person freaks out and said, oh my God, I don't want anything to happen to my baby, cut the baby out. So these are all little subtle things that can happen in a very typical and almost helpful way. However, it starts taking your power back. So my definition of gentle birth is to acknowledge the mother's innate capabilities, acknowledge the baby's innate capabilities, and then support them in the best way possible to bring to the mother comfort, peace, and relaxation. And if you can do CPR, comfort, peace, and relaxation for labor, the baby's going to come out all on its own.
Absolutely. And then let's talk about these 3 interventions in the hospital, and then we're going to get a lot more into gentle birth. Because I think a lot of people, they think you're going to a hospital, you're getting the best possible care, medical interventions are safe, or they wouldn't do them to me and my baby. But we have some very controversial ones, and the ones that I'm going to talk about is the ones that moms in the autism community are concerned about, that they did with their first baby, they didn't have the best outcomes, and they're trying not to. So one of the things we know, Pitocin. And I'd love you to talk about, Pitocin has kind of been implicated a little bit with autism. So has excessive ultrasounds, heating up the baby. Like, people don't think of these everyday things. And epidurals, people don't think of them as having risk. And we know that they can have great risks with certain women. So can we talk a little bit about the cascade that happens when you get to a hospital and how sometimes one intervention can lead to you having all three, which is Pitocin, epidural, C-section?
There's a wonderful study that was published in the British Medical Journal in 2004. It was a randomized controlled trial taking women that had their labors stalled after 5 centimeters of dilation. They were admitted to the hospital in labor, and then after 5 centimeters dilation, they had no more powerful contractions to increase that dilation for at least 4 hours. They had no progress. And they were divided into 2 different groups. The first group was given Pitocin, which is exactly what when you don't fit that 1 centimeter every hour dictate, called the Friedman curve, then Pitocin comes out very liberally. Or if you're an induction because you've gone past your due date by 24 hours, instead of the normal, you can go up to 2 weeks to 42 weeks, and it's perfectly normal. So the Pitocin comes out, and in this study, the second group were given nothing except a warm bath, and that was it. And the outcome was that the people who took the bath delivered 2 hours sooner than the people who took the Pitocin, and every single woman that had Pitocin requested an epidural for pain. And then, of course, with an epidural, there is a cascade of effects for both the mother and the baby that I'll address in just a moment.
And a lot of times people don't understand that the Pitocin leads to the epidural because the contractions are so much stronger and they're faster. And then you have a mother who's in so much pain. And explain what problems the epidural causes in labor as far as not allowing the mother to progress nicely through to the birth.
Well, first, I'd like to explain what's wrong with the Pitocin.
Okay.
And the Pitocin is the chemical substitute designed in a laboratory that matches the naturally occurring hormone called oxytocin. And oxytocin is released from the brain, the mother's brain, and it is never released singularly. It is always accompanied by endorphins, which are the hormone of transcendence, and it's the naturally occurring endorphic or endogenous morphine for our perception of pain. And so once you get the Pitocin on board through your veins and not your brain, the brain says, "Oh, all the receptors in your uterus are completely filled up, and I don't need to produce anymore. And if I'm not producing brain oxytocin, I'm no longer going to produce brain endorphins either. And I just might slow down and not produce any adrenaline or norepinephrine, because all three are related." Now, when do we need adrenaline? To push the baby out. When does the baby need adrenaline? To transition from a fetus to a newborn. It has to open up its bronchioles. It has to get rid of the fluid that's in the lungs for the lungs to expand and be able to exchange oxygen and carbon dioxide. So a woman that takes an epidural because she now has painful contractions that she can't control, because normal contractions under brain oxytocin have a wave, a sign pattern, SINE, and and they come in in threes, just like the waves of the ocean. Now you give the Pitocin in the vein, and it's wham, bam, thank you, ma'am. And the contractions don't stop. They go back to back to back to back. And in a normal labor, a normal physiologic labor, 3/4 of the time you're resting. 1/4 of the time your uterus is contracting. So for every hour you have 45 minutes of rest in between 15 minutes of contractions, and that goes away with the Pitocin, and you call for the epidural. I can't take this anymore. Give me the epidural. And with the epidural, there's 2 drugs used. There's usually fentanyl. We've all heard about fentanyl exposure and the opioid epidemic. So fentanyl is the narcotic, and then bupivacaine, which is a cocaine derivative, is the anesthesia. And so you get both anesthetic and a narcotic put into your spinal column, and within 45 seconds it goes to the baby's brain, and it has to pass over the barrier. They didn't think so at first, but I've been able to download and read articles that were published in the Journal of Anesthesiology about the effects of the epidural. And I won't ever tell a woman you can't have an epidural. However, if you prepare her in other ways, she won't want an epidural. She will. I call it 100 ways to love your labor, and that means staying centered and grounded, and using things that both distract you and give you pleasure. You increase your oxytocin, which then increases your endorphins. So the epidural has some other side effects besides the baby getting the drugs as well. And one of them is with an epidural, you have to have a lot of IV fluids. So an extra liter of IV fluids, which then causes engorgement in your breasts, and the baby has a harder time latching, both from receiving the narcotic and from having engorged edematous breast tissue. That's just one of the places that becomes swollen from the extra fluids. So when you have an epidural, it's not impossible. However, we make a big challenge, and babies who don't have enough of the naturally occurring hormones in their own body have a much harder time transitioning from being a fetus into a newborn, and they get resuscitated much more often, cords cut, they're a little limp upon arrival, and everybody goes, put the baby in the NICU. And once the baby goes into the NICU, it interrupts those first 1,000 minutes, which are absolutely sacrosanct to have the baby in the sanctuary. And this is the most critical time for nurturing. And the science of nurturing says that the baby turns on its amygdala, which is about fear. The baby turns on its cingulate. It turns on its pineal gland in the sanctuary and no place else. So the epidural can actually cause you to risk being separated from your baby for a longer period of time. And I don't want to scare anybody, because I'm a firm believer of whatever has been broken can be repaired. But it's much easier to start out the baby with a physiologic, normal, gentle birth than it is to repair the relationship between a mother and a child, even at 3 weeks or 4 weeks or 6 weeks or 1 year or 2 year or 3 years. I've done a lot of therapy with mother-baby dyads over the years to repair that brokenness. So the epidural is, if you want to be numb from your nipples to your toes, so that you have to be carried to the top of the mountain. Otherwise, you listen to your feet and you practice what I call love awareness, LOVE. You listen to your mind chatter. What are you afraid of? Face the fear, okay? Face it. You observe, LO, observe your body and the reactions to what the mind thinks the body feels. And then V, validate your feelings. It's okay to have those feelings, especially in labor. And then E, educate yourself so that you can change the behavior, because in every single moment, we can choose to stay in the fear or move over to the bliss side, the love side. So by doing this process of listening, observing, validating, and educating, we learn that normal birth, natural birth, is a journey, it's a process, and that we value the process for both the mother and the baby. Your postpartum will be 1,000% easier if you leave the drugs out. I guarantee you.
Oh, I agree. I think the difference in my son and my daughter's birth, I would do my daughter's birth over and over any day. I think what's scary is most women, we're conditioned, because up until I had my daughter, I was conditioned to what the movies showed me, which is this woman in terrible pain and it's awful until she gets the drugs and it's over. And a natural childbirth is so much easier. Actually, people just really don't understand, that you just keep yourself relaxed, you have techniques, and we'll talk about some of those. And a cesarean to me is like this scariest thing, and it has so many complications. And one in the autism community that we pay attention to the most is the baby's microbiome that they get coming through, the vaginal canal. And, when you get a cesarean, you get exposed to a very different microbiome from the skin and the instruments. So let's talk about why elective cesareans may not be the best thing, and what are the downfalls of them, because everybody thinks they're like no big deal. They knock you out, they take the baby out, but they're not no big deal. Major surgery.
In these days, I work globally. I have taught in 75 countries. And when I talk to audiences, I was just consulting with a hospital in Israel this morning. I was supposed to be there today to teach in one of the largest Orthodox hospitals in Jerusalem. 25,000 babies every year are born in that hospital in Sha'arei Tzedek. I can't. And they've had even more babies in this since lockdown. And when I mentioned to them that women in America are given a choice to skip labor and have a cesarean because they're afraid of giving birth, you should hear the reaction globally. In Sweden, if you go to your first of all, midwives are the caretakers of normal birth in all of Europe, everywhere in Europe. And if you go for your prenatal visit with the midwife and you say, I'm really afraid of giving birth, I've decided I want to have a cesarean, an elective cesarean. The midwife will look at you and say, okay, this is how we do this. Here's your prescription, and please go and see the psychiatrist. You have to have 3 visits with the psychiatrist first before and find the origins of your trauma as to why you would not want to participate in a normal physiologic process. And so you basically have to get counseling to find out why you're so afraid of it. And they have about a 96% rate of women changing their minds after they go through the counseling. So there's a lot of things going on in Northern Europe. You find a much less elective cesarean birth rate than you do in the U.S. And I'm not totally against it, and I'm not going to tell anyone that it's going to be horrible for them, but I state the facts, and the facts are, yes, you need the secretions that the baby picks up in its mouth and on its skin from the vagina. 25 years ago, when I would have a home birth client end up with a cesarean, and my cesarean rate from home birth transfers was 3%. So out of 100 women, 97 of them would have a vaginal birth, and 3 of them would have a cesarean. And one of my best friends did that with both of her sons. She tried both times. And the first thing I had her do when she got the baby after an hour or so was I said, put your fingers inside your vagina, get them all gooey and sticky, and rub the blood all over the baby's face, and put your fingers in his mouth. And she looked at me and she goes, really? I said, yes, the baby needs your bacteria. And once I said that, she was like covering the baby, you know. I said, just don't let the nurses see you do it. Because the bacteria, it's the good bacteria. And 3 days after birth, all of the scientific studies will show you that, let's say there's 5 different types of bacteria in the vagina and different amounts of each one of those bacteria. If you swap the baby's mouth after vaginal birth at 3 days, they match exactly. And that microbiome gets put into the gut. And in the first 3 days, when the baby is suckling and receiving the colostrum, the colostrum mixes with that bacteria and creates the perfect medium to be able to digest the proteins in breast milk 3 days later. And so if you don't have that, we see a much higher morbidity of gut dysbiosis, diabetes, and problems that can lead to gut-brain dysbiosis, which in your community is one of possible contributing factors to the rise in autism. So we need that connection. We need the connection emotionally. The sanctuary creates the perfect environment for the baby to have warmth, safety, nutrition, and oxygen. And that's exactly what the baby received inside the womb: warmth, safety, nutrition, and oxygen that the placenta and the womb provided. And now the mother's chest and arms and breasts provide that very same thing, because when babies are born, every single one of them is immature, an immature brain, an immature immune system, an immature physical structure. And so they need protection for the next 9 months, 9 months in, 9 months out. And before they can eat and digest and all of that takes place. And that first we said 1,000 days, but I'm telling you, the first 3 hours to 6 hours are the most important. And if you want to savor that, then you must remain undisturbed. And I like to call it undisturbed birth more than normal natural birth, because we've co-opted natural. Oh, it was born vaginally. It's a natural birth, right?
So I think most people would be surprised to understand how high the elective C-section rate is in this country. I mean, it is like 30 or 33% right now. Is that correct? And
most of that election is for subsequent babies. Instead of having a vaginal birth after cesarean, they're repeat cesareans. And I've been surprised actually that the depending on where you go, the more midwives you have in any given hospital, the lower the primary C-section. And I like to call it cesarean birth instead of C-section, because if we can understand that this is the birth of your child, so the primary cesarean birth rate is much lower in hospitals that employ or have privileges for certified nurse midwives.
absolutely. And so, there's so many of these interventions that are in the hospital that people are just not understanding. There's the ones that are during the pregnancy that you talk about in your book too. You talk about an amniocentesis, which I elected not to have with both my children. I mean, when I read that you could miscarry 1 in 500 or 1 in 400, I just said to myself, I mean, if it wasn't going to change the outcome of whether or not I had that baby. And that's what my OB went crazy, because I was like 39 with my daughter. But I said, it's not going to change what I do, so I don't need it. You know what I mean?
Both the ultrasound and the amniocentesis are overused, with no change in the outcome. What you just said, if we can just pick that apart for just a moment, and I'll tell you a story of a young couple. They were 18. She was 18. He was 19. And they came to me for care, and my friend Jennifer, who's also a midwife, and the baby was actually born at my house. I had a suite that we had for couples that lived too far away for me to go to them, so they'd come to me. And they were religious people and didn't believe in the ultrasound. They had no ultrasounds, none. They did allow blood tests because there's a certain baseline of your hemoglobin, your hematocrit, your white blood count. You want to make sure that there's safety, a safety net. But as far as listening with a Doppler, which is an electronic, also pulsar wave, it's a microwave that goes into the baby. And the ultrasound, the World Health Organization recommends that you have no more than 3 ultrasounds your whole entire pregnancy, because we don't know what the after effects are going to be on a population that has no say in the matter. And I know doctors in many different countries around the world, including the US, that will do an ultrasound for every single prenatal visit to measure the baby. Well, how do we measure the baby? With our hands and a tape measure, and we listen with the fetoscopes, and we only use a Doppler during the labor so as not to disturb, and not all the time then either. So this couple had said no ultrasounds. And we had the discussion, well, what if there's something wrong with your baby? And she said, it's God's decision. We'll accept that baby no matter what, including downs, including deformations, and And the doctors will give you a long list of everything that they're looking for in doing the amniocentesis and the ultrasounds. Well, her labor went beautifully, and she gave birth in a birthing tub at the foot of the bed. And I was catching, and I was the only person in the room that saw that this baby, when it came out, had multiple deformities on its body. And I put the baby in the sanctuary, put a blanket over it very quickly, and nobody saw. And I got my stethoscope and listened, and the primary deformity was there was 3 little digits instead of an arm, a humerus. There was no humerus, no lower arm, no radia, no ulna, no hands on this baby on both sides. And finally, and the couple held the baby and rocked the baby and kissed the baby, and the baby started breathing and it cried. And all of a sudden the mother takes the blanket off after about 3 to 5 minutes, and she looks down and she looks up at her husband and she goes, "Honey, look, God gave us an angel. She came with wings."
Oh my God. Wow.
Yeah. And so they meant every word when they said it's not going to change the outcome. And for some people, I mean, there's lots of things that are difficult to accept. And in the Orthodox community in Jerusalem, they don't get ultrasounds. Maybe 1, maybe 2, dating ultrasounds and things like that. But the midwives take care of them. That's the same way in Williamsburg, in Brooklyn. So they're going to accept whatever God gives them in that sense. And we've learned a lot from these couples with their fortitude and their willingness to accept what comes. So once again, I'm not against ultrasounds. I have for a good friend, a pediatric cardiologist, and he's been able to be on call for a birth where a newborn needed open heart surgery because of the ultrasound that was predicted. And so there's some very good things, but as I said in the very beginning, each technology has its really good points, and it has a dark side to it as well, and overuse of the technology today, because in Mexico, Venezuela, United Arab Emirates, Saudi Arabia, Turkey, I've been to all of these places to teach. And if you are diagnosed on ultrasound to have a cord entanglement around the baby's neck, it's an automatic cesarean. And in some of these countries that I've just mentioned, those hospitals have cesarean birth rates of 85 to 90%. And that is a travesty and a crime against humanity.
I agree. I wrote an article for Green Med Info about it's very scary. Brazil's like 90% in the private hospitals. And a lot of times I think the hardest part is a lot of the patients are, I'm going to use the word coerced, because they are. Yeah, and I think the most important thing, and I really hope people take the time to read your book, because unfortunately we're not going to be able to go through every single thing. We still have more to cover, but there's so many important things about getting informed and educated on, like you said, the good side, the bad side, the pluses, the minuses, and making that informed decision and taking charge of your birth. So another example is you talk about that sugary drink that they make you drink to see if you have gestational diabetes. Well, I would drink it in my second pregnancy because I'm working so hard on my microbiome. I'm not eating sugar. And I'm like, I'm not going to drink that. And guess what? My OB just did blood work. She goes, oh, this is going to be so much better anyway. This will tell if you have anything going on. I said, well, why don't they do this to every pregnant woman? And she said, oh, it's too expensive for the insurance companies.
Right. that the dictate of what we can do and how we can do it and what is paid for is run by the insurance companies. And anytime you manage to combine power and control and money, the outcomes are not good. This is why all of Europe has much better outcomes. There's and by the way, today is a perfect day for this interview because it's International Day of the Midwife. Oh. And the World Health Organization, before coronavirus started on January 1st of 2020, the World Health Organization said this year is dedicated as the year of the midwife and the nurse. So for obstetric nurses and midwives throughout the world. So in writing and doing the research for genital birth choices, I wrote to lots of colleagues in Germany and Sweden and Norway and the UK, even in Spain, and said, what tests are you forced to take? Well, they just take your blood sugar level. The glucola, drinking the glucola is not required in a lot of places. Group beta strep has been outlawed by the test, has been outlawed by the National Health Service in the UK because they spend more money on the test to find the 1 in 10,000 babies that are at risk. So why spend all that money on the test and then subject every single woman who tests positive to massive doses of antibiotics, which will then harm her gut bacteria? So back to the original definition of gentle birth, we recognize and support the woman's innate childbearing abilities and the baby's innate abilities to be born. And so however we can support that, but we have to recognize that some of the things that we do interfere with the normal physiology of the human reproductive system. And I don't want to pick it apart. It's not just reproduction, it's prenatal, birth itself, intrapartum, postpartum. It's one continuous flow. And you cannot separate it from the rest of your life. You said, you did things differently to change your diet and change your thinking as well. So all of that has to go together.
Exactly. And I'm glad you brought up the postpartum, because women are kind of left for dead that have a hospital birth. There's no postpartum care. And I do think that is so significant. And I think I would love, now that we talked about a lot of the things that, the medical interventions, the technological advances that aren't so helpful, let's go through what makes a gentle birth. And one of the things I would love to talk a little bit about waterbirth and position of the baby, because when you don't give birth in a hospital, I was lucky enough to have a squatting bar. I had a nurse that brought one in and put it on the bed with my daughter, so thank God for that. But let's talk a little bit about position. There is not one position to have a baby in, right?
It's, once again, it's this collaborative care, but, and prenatal education is the key. So knowing, like we talked about earlier, that you have choices. If you're in the hospital, you can get out of bed, put your feet on the floor and lean over the bed. I was at a birth in late November. I was in Saudi Arabia for the first time, in a big hospital in Jeddah that had a 95% cesarean rate. And they asked me to come in and train their staff and to attend the birth of the first woman that wanted to use water. Well, they were pretty much blown away because, yes, we used the tub, but we also used the squatting bar. We also used the toilet to sit on for contractions. We used a rope that hung from the ceiling. This woman was all over, but she was not in the bed at all. And that they were so surprised. She would get in the tub for an hour, and then I would ask her to go to the bathroom, and she'd sit on the toilet. She'd come back and sit on the squatting stool, and then she might lean on the bed for a little while, and then go back into the tub. And by keeping the birth active, you are moving your pelvis. And I was trying to see anyway, I have a pelvis, and so when you're moving your pelvis, the baby is navigating its way through that pelvis in a much faster way. So the position of the baby, it's not so much whether you're open 10 centimeters, but where's that baby? Is it head down with this part of the head coming to a crown? And when the mother is in tune and is in an intimate relationship with her body, then she can feel those movements of the baby through her. If she's locked onto a bed with an epidural, she has no relationship to the movements of the baby. If she's locked on the bed without an epidural, she can still feel the baby moving, but it's much harder for her to turn onto her side, left side, right side, up on her knees, squatting with the squat bar. All those things become much more difficult. Getting into the water is the great liberator, because you can move into any position and it takes the weight off of your back, your legs, your bottom, and your job is to release your bottom. Just visualize like letting the bottom drop out. And that's going to prevent tearing. That's going to, because the baby's coming no matter what. You can't stop it. Even if you're in a deep state of deep meditation, relaxation, and you didn't even do a thing, the baby's going to come out. And many of my clients will look down into the water and say, "Oh my God, the baby's here." And they didn't know that the baby had been born.
Wow. Now let's talk about some of the elements that make up a gentle birth. And one of the elements that I used that I found incredibly helpful was hypnobirthing. It was amazing for me. It was the reason. It was what got me through it. It was wonderful. I was leaned over the bed on a pillow, and the changing positions, like you just mentioned, going all around until the birth.
What the mind thinks, the body feels. What the mind of your provider thinks, your body feels. So when I'm training providers, and I use something like hypnobirthing, it's called Blissborn, blissborn.com, and the woman who designed it was looking for something better for her second, maybe her second birth, yes. And her name is Laura Wood. And just like Mickey Mongan created hypnobirthing, Laura created Blissborn birth hypnosis. And it's amazing. It's just amazing. And I've taken it to the next step with her to train practitioners how to keep a woman loving her labor. 100 ways to love your labor. This is 100 ways to make birth gentle. And so if I could sing it in eye contact, soft voices, I ask every single woman to visualize a place where she feels safe, where she feels loved, where she feels empowered. It's not about having control over someone. It's about helping her find the power within herself so that she knows, I'm doing this. I'm capable of this. I'm more than capable. I'm invincible. I have courage. I have fortitude. I have strength. With every breath that I take, I release my bottom. I release my baby. And so practicing with that prior to the birth changes your thought patterns and behaviors from fear, tension, and pain to comfort, peace, and relaxation. And my job is to support you so that you have CPR for your labor. And CPR can come in all of those other gentle ways, like being in the water, being in the shower, sitting on a birth ball, hanging from that cloth from the ceiling, using a squat bar, not disturbing the environment, pulling the curtain and giving you privacy, because your oxytocin and your endorphins will blossom into full motherhood in a private environment. You can still have privacy in the hospital. And I encourage women to put up their affirmations where they can see them. And if not affirmations, then just simply beautiful pictures. Pictures of waterfalls and forests and beaches, and because what the mind thinks, the body feels. And so all of those things. And I engage the partners to know when your forehead goes like this, to just put a hand there and say whatever words that you have rehearsed. Breathe, relax, take a deep breath, whatever you have agreed upon. Those are the words that you want to hear. And when women ask for an epidural, what they're truly asking for is, I need more support. I'm starting to not be able to handle this. So please support me more. And they don't know how to say that in the modern context, because all you get is a nurse that comes in and out, and you're left there. If you have not taken the classes ahead of time, you just don't know. You don't know. And the nurses aren't trained. This is why I'm traversing the globe. I traveled 177,000 air miles last year, 19 countries. Don't ever do 19 countries in 1 year at 68 years old. Thank you very much. It was a challenge, but we got it done. And I trained thousands of practitioners, thousands over the last 10 years on how to keep birth gentle. I give a degree for doctors in Latin America that's a parto suave, gentle birth. They have a gentle birth degree after they take my 3-day workshop. And they go back and they change their attitude. And another way of keeping birth gentle is to have undisturbed skin-to-skin quality time, with plenty of time for the baby to find the breast by itself and latch on within that first 1,000 minutes.
And I think another great thing that you talk about is, a couple good things are a doula. I found having a doula extremely helpful. I'm just going to tell why I found it helpful is people don't understand that when you go to a hospital, if they admit you and you're not in active labor and you're not progressing, that's when they bring out all the bells and whistles. And so I would go to the hospital. My doula would come with me because she wasn't positive whether I'm in labor or not. They would check how many centimeters, and they'd say, oh, well, you're 6 centimeters, but we're going to admit you. And I looked at them and I said, am I in active labor? And they said, no. And I said, okay, I'm going to go downstairs and get a cup of tea and wait in the cafeteria. And I basically would go home. And I did this 3 or 4 times because of my son's first birth, I didn't know what active labor felt like. And my doula kept telling me, you're going to know when it happens. And she was right. And the 4th time we went to the hospital, indeed, I was in active labor and I had the baby just a few hours later. So I think a doula can be just so helpful, support everything.
I train doulas, and you can also get a degree as a gentle birth guardian or gentle birth doula in lots of different countries around the world. And I teach them to hold the space. And holding the space for you means that you get to follow more closely your body. But if somebody walks in the middle of your contraction, the doula is going to go like this. She's not going to let that person that walks in the middle of your contraction to disturb you. She keeps the environment. I call them environmentalists. They create a very sacred and spiritual environment in that space. Anybody that graduates from one of my programs is more like a spiritual doula as well, because she can see into your soul in the sense of knowing what you want before you ask for it, because I don't want women in labor to have to ask for anything. I want them to respond to their bodies. And if you go like this, my hands are going to be on your hips. If you go like this, I'm gonna do some light touch on your back, or train your partner to do the light touch as well. I came into a hospital in Saigon last February. No, it was last May, but I was in Saigon, and I had been there teaching for a couple of days, and they said, "Would you show us what you're talking about by attending the births of the next 3 women that come in?" And 3 women came in that all had good command of English. And so I took some of the nurses into one room, some of the nurses into another room, and we did 100 ways to love your labor. I was training them how to be a doula. And I brought in the ball, and I brought in the rebozo, and I brought in the water. Women should just be offered a drink. And I was teaching the hip press and pressure on the back. And all 3 of the women were like, "Oh my God, where did you come from? You're like a fairy godmother," And all 3 of them had normal births. And it was so unusual at that hospital with a 90% cesarean birth rate. So a doula is worth her weight in gold, absolutely, because she focuses on you and not the medical side. She is there to support you emotionally and physically and spiritually, so that she can be your best friend, your godmother, your fairy auntie, and your grandmother all rolled into one. And she can help you by fielding questions, but not making decisions. She'll give you the information so that you make the decision yourself. So, yeah, doulas are amazing.
I found her invaluable. And even after coming over and helping with breastfeeding and checking in and seeing how I'm feeling, if the bleeding stopped. And I mean, I have to tell you, the difference of the postpartum recovery from my son and my daughter, I felt amazing after my daughter. I mean, 5 days later, I'm fine. After my son, I think I was in pain for 1.5 years for different things, muscles that got stretched out and things, and it's just, and I think the saddest part is when you're at a dinner party and you explain to someone you had a natural childbirth, they look at you with the gas, like, oh, they can't believe it, because it's like, I wish I could express to people that it is amazing. It's beautiful. I mean, I always tell people it was my Mount Everest, exactly. I was high off of it. Was it challenging? It was the most beautiful challenge. It wasn't as painful as my son's birth. No. People don't believe me. I broke every blood vessel in my face for my son's birth because he had what you called freezing, where the epidurals given too early and they freeze in position. I couldn't get him to budge, and they told me I was going to have a C-section after an hour and some odd pushing. And so I said, let me just push one last time. And boy, I gave it everything I had. I broke every blood vessel in my face, but he came out, and to this day, like I always wonder what all those things that were done to him. He was jaundiced when he was born. I mean, there were just a lot of signs that were there.
Yeah. It's, I had an invitation to appear on Oprah before she stopped. It was in 2009, early, and the producer wrote to me and said, I want you to come on, and I want you to give us names of mothers who've had one technological birth and one normal birth, and talk about the differences. And I refused because like I said before, anything that's been broken can be repaired, in the sense of the things that happen in a technological birth, the separation, the drug use, all of that. Babies are the most resilient part of human life. Is infancy, is that newborn, and so much gets fixed with love and adoration and appreciation and parenting. And so I refused to go on Oprah and have two children compared to one another.
Yeah.
Because you know that's like asking the two women who are fighting over the baby, who loves it more? Your two children, do you love one more than the other? No, absolutely not. You might prefer to be with one more. But my kids are now 42, 36, I have to think, 42, 36, and 33. And they all keep track of me and try to keep me indoors during this coronavirus. But and it was my daughter, when she was older. She's 6 years older than her younger brother, and she said to me, why are they so calm and peaceful and smart, and I struggle with everything? And she was a hospital birth with bells and whistles, and they gave me drugs without my permission, and that's what started me on writing Gentle Birth Choices, because I had a subsequent home water birth. I would have had a water birth in the hospital, but in 1984, it wasn't possible. And now, today, it is. I've trained thousands and thousands of midwives and doctors all over the U.S. and throughout the world. And so a gentle birth is possible. You have to educate yourself. You have to give yourself time to practice at least 6 weeks prior to your due date. Start taking a Blissborn course, a hypnobirthing course, and you can do them by computer now. I've got one coming up for a woman, just a private session with her. And prepare your mind, your body, and your baby and your partner for a gentle birth.
Absolutely. I can't thank you enough, Barbara. I mean, this has been amazing. And I have to tell you, I recommend your book constantly to people. And I just, fell on it by accident, thankfully, on the Barnes & Noble website. But I hope that viewers will take the time and read your book, because there's so much in it that we just can't cover. And it's amazing.
Yeah, it's still selling well. I still get royalties every 6 months. And the electronic, the Kindle edition is probably sold the most these days. I don't think that has the pictures in it. The pictures are very, very good. from a couple of different sources. So, well, thank you, Dara, for going through this with me, and good luck with your kids and with coming out of quarantine and doing the important work that you do with this.
Thank you. And we're going to put up your website so people have more information about where they can learn about waterbirth and everything else that you do. So that'll be up at the end of the podcast for them to see. Thanks again.
My pleasure. Take care. God bless.